Good afternoon or good morning again, everybody. We're right at 1 o'clock Eastern Time, so we're going to go ahead and get started with the webinar to keep everybody on schedule. And if you have any questions or have trouble seeing the screen, um, you can go ahead and type that in there. Somebody says a question, how do I open the video? And I'm not sure on your end how you would do that. It should be open. No one else has sent a question in that regard, so I'm assuming everybody else can see it okay. So you may want to check with someone in your office there, but that's the only question I see at this point. But we're going to talk about demystifying assisted living marketing. The session is going to be recorded, so afterward, if you've got people in your company or community that need to hear this information, the recording will be accessible later on, and we will probably send you a follow-up email to show you how to do that, because we'll know those of you that were here. So the folks that are presenting today are myself, Rick Hunsaker. I'm now with Levin Company and VP of Sales Services for the Western Division, and it's been 5 months now that Hunsaker Senior Living Services, the company that I had, did merge in with Levin Company. And I've got 31 years in senior living marketing and sales, and you can see my email address there if you want to connect me. And some of you have been on webinars that I did before, so it's nice that we're going to continue presenting great educational content for you through webinars. So Chris Carruthers is also here. And Chris, do you want to tell them a little about you?
Sure. Hi, everyone. Chris Carruthers. I am the VP of Health Marketing Services. We have a separate division at Levin Company that focuses only on the health services side of things. So assisted living, memory care, rehab, skilled nursing. Those are the services that I oversee.
Okay, good. Well, you can see on the screen now, should be able to see where you type your questions. It's in the upper right-hand screen, and where that arrow is where you will type your question. So right there where you see it kind of dark, that's where you type in any question that you have, and then when you type it in, hit send. You see the little thing on the bottom right-hand side of the screen there. You would send the message there, and then it's going to show up for us like this. Your question will show up, so we'll know that you've got it. And our plan is to answer the questions at the end of this session. So I'm going to go ahead and start out with what our plan is today, but I thought I'd just say one more thing before we get into the specific plan for the day. And it's Chris and I are going to try to make this as conversational webinar presentation as we can, just because it seems to go over much better that way. But also, just if there's something we think of as we're going through this, we're gonna we're gonna bring it up. And then if you guys have questions, just type them in, and at the end of the presentation, we will go ahead and review those questions with you, because you may have the same question that others have had, and we found that very helpful in the past. But the assisted living and memory care market is exploding, as you probably know, and it's one reason that Levin Company has now got a separate division to help people in that area. And if you're like many communities around the country, and I'm from Texas, so I can just tell you in Texas, the assisted living and the memory care in particular is just exploding. So what we're going to do is, and that exploding, I'm talking about the competition and the availability is exploding. The demand isn't necessarily exploding yet. It will as the baby boomers, reach their 80s, but there's certainly a lot of supply out there, which means you guys and we all need to really, really do everything we can in our marketing sales to get our share or more than our share of the market that will actually be moving into the communities. So we're going to talk about shifting the mindset from order taker to proactive strategist, because like in the days, old days of independent living, it was really sort of a build it and they would come, and that's certainly over. Assisted living is as well as memory care, as you know, is becoming extremely competitive with all the providers. And as I mentioned, Texas is just an example, but I know it's happening all over the country. So our mindset really needs to be proactive and strategic. What are we going to do to get our share or more of the people who are actually going to move to assisted living? And then applying a metrics-driven philosophy to your sales and marketing program. And that basically means really understanding what is really going on with all of the numbers that drive your sales. And we're going to get into some more detail on the metrics and having a philosophy of I need to understand the numbers because they drive the production. And then Chris is going to talk to you about outreach because, you know, outreach is extremely critical and becoming more so. In fact, many of your current dependable referral sources are actually starting to narrow down their list of preferred providers, possibly through ACO and bundled payment programs for skilled nursing at this time. But when all of those referral sources start hearing about that, then they think, oh, well, that's the only people we can refer to. If they're not a member of our program or our preferred provider group, then we can't refer to them. And they may perceive that that means we can't refer to you for AL either. So you need to definitely be aware of that. And all of this is a result of the new provisions of the Medicare reimbursement situation related to all the readmission stuff. So you may say, wow, that sounds like nursing care marketing. Well, it does, and it is, but it certainly applies to the perception that the referral sources have. So if we're going to have somebody out there working to just generate referrals for us, what are the key characteristics of an outreach coordinator? And who do we need to be calling on? What are the targets and what are the audiences that we need to be focusing on? And we're going to talk about that. And then how does the experience that a family member or even the senior when they're along with them, as well as the professional referral sources, what is their experience when they're at your community? What impact does that have on sales and marketing outcomes? And I can tell you it has tons to do with it because we just moved my mom into assisted living initially just about a year ago, and now she's in memory care and she's done a lot of the transition. So I kind of can relate to all of this right now from a personal perspective. And that experience when someone is shopping and checking out places has tons to do with their perception of, is this a place that I would want to come to visit my mom? And is this a place that I think my mom would be well cared for? So we have an interesting slide up there because we presume that most of you or many of you are working in the CCRC type of community, which now, as many of you know, are called life plan communities. We wanted you to see the spectrum of services that are actually available to seniors in a life plan community. And that is from way early on into independent living all the way through skilled nursing care and rehab up until post-acute or acute care. Obviously, you're not a hospital. But we have the opportunity to capture or provide services to residents and families in a much wider spectrum and, frankly, a much wider age group than those that are standalone communities. Now, some of you may be from standalone communities, and that's fine. You have, obviously, some unique challenges as well, and the CCRCs have some unique challenges, but also some unique opportunities. But one of the things that I do want to mention for the benefit of those of you that are working in a CCRC, I had a opportunity to meet somebody that is really, really heavily involved in all of these ACOs and bundled payment plans and all that kind of stuff, where they're really trying to go out and narrow down who the best providers are for their patients or customers that they're going to be referring out. And this person said that they're finding or seeing that a continuing care retirement community where all of the levels of care are within one community and basically one team that's moving the resident through the process provides for a much smoother transition and therefore much better care. And I can tell you, my mom did not live in a CCRC when she needed to go to assisted living and then to memory care and actually into nursing for a little while as well. So she's had numerous transitions, and let me just tell you, it's been a nightmare because every place is new, all the people are new, and so this whole helping people get transitioned to the appropriate level of care is a big deal. And in many cases, it can be certainly accomplished well in a life plan community. Or if you're not a life plan community, but you have IL, AL, and memory care all on the same campus, well, at least you would then be able to have the same team do the movement of the resident through the areas of care that you have in your community, and that can be very advantageous to you. So, benefits of being proactive. All right, so let's get back to the numbers. I wanted to make two very clear points for you. And regardless of where you are in your AL or memory care occupancy, because of the high turnover in these areas of care, you've got to have your move-in or admissions goals for new residents who will replace your turnover units, as well as fill whatever existing vacancies you have if you're still in fill-up mode. And we see many communities develop sales goals for AL and memory care, like, okay, we need 5 move-ins a month just to keep up with the turnover. But we're really seeing many that don't have a realistic sales plan, or in many cases, even the marketing budget that will power the team, power the lead generation, provide the tools to reach those goals. So proactively providing yourself the power to get what you need done and understand the numbers that need to be made and have a realistic budget are critical. And even though you will start with your move-in goals, you've got to realize that the selling and the outreach activity drives the move-ins and referrals. And another key point here, the right kind of selling and outreach, and it's not just hitting the numbers. And I'm going to give you an example in a little while where it's not just, well, I got the numbers, yeah, but was the presentation or the call a quality call? So hitting the numbers is critical, but the quality of the engagement that you have with the prospect is also critical. And when you look at these numbers, I just want to tell you that it's predictive. And I'll just give an example again that I was at a community this week actually, and we were looking at their call out and their appointment numbers over the last 4 quarters. And we saw 2 quarters where the call out numbers were low, and guess what? The appointments were low. And then the other 2 quarters rather, the call out numbers were much higher. Guess what? The appointments were much higher. And the sales were much higher. So it really all does flow from the beginning of your engagement with the prospect through the calls that sets the appointment, which sets the presentation, which sets the move-in. So you need specific activity goals, and we do want to make a point here about the daily, weekly, and quarterly, not just your annual goals. It's so much easier when someone understands, today, what do I have to get done? So that at the end of the week, I have achieved what I need to achieve. Now, we certainly understand that there's going to be days that you don't get it done and you're going to catch up later in the week. But just to know, on a daily basis, what are the expectations for your team, and that your team says, I know today I need to make, a minimum of 10 call outs today and 2 appointments or 3 appointments or whatever your market's determining is required or possible in your market area. At least they know on a daily basis, I'm getting paid to make these calls and to have these presentations. And by the end of the week and the end of the month, if they're focused on the daily requirements and realize to catch up if they fall short, things will be much easier to manage going forward, personally as well. Now, tools to be able to monitor all of this activity. As a proactive strategist, you want to have the tools to monitor performance against your strategies and tactics, and you want to get the real-time feedback, and that's why having an effective CRM is so critical. And most of you have CRMs, but I can tell you there's a lot of them that are not used, one, consistently, and not used as deeply as they can be used. And many times we're finding that the area is in referral source recording. And Chris is going to talk a little bit more about this. So the use of the CRM to record all your referral source activity, especially the number of referrals that they're sending you, is going to help you understand the ones you need to continue visiting. And you can also use the data in the referral sources, because if you put in all of those referral sources that you should be getting referrals from, and then you see that you're not, then you know these are the ones we need to proactively pursue. We are getting a lot of referrals from this group and this group and this group, and that's good, and we need to keep it up. But why aren't we getting any referrals from this group? And if you're tracking it, then you're going to know those you're getting and those you're not. So, applying metrics-driven philosophy to your sales and marketing program. In some instances, we're starting to see that the assisted living sales cycle is getting a little longer than it used to be. And you might say, well, why? You know, it's a pretty quick sales cycle. Yeah, it used to be when there were 2 or 3 AL competitors in your town. Now, and I, again, experienced this with my mom and my sister, like there's 6 or 8 or 12 that, you know, we could have looked at that were within a reasonable distance of where my mom was. So there's so many options today. So many of the adult children are actually taking a little more time, unless it's a crisis, of course, and looking at all of the stuff that's out there. So it is a little bit more of a process than before. So in applying the metrics to say, okay, well, with all of these customers that are coming in, how are we doing? And I've shown you 4 boxes here that we think are really the key metrics that would be applied as far as measuring, you know, what's the effectiveness of our selling activity and our referral generating activity. So you see that on the screen. And let's just say that you said, well, we would like, or we are getting 25% of all the leads that come into our system actually end up visiting our community. Boom. Now you've got a metric that is either your goal or your target or what's actually happening. And I can say that that number may be less than what is realistic in your market area. Then your follow-up calls, you might say, well, they're adult children, they're hard to reach, and we're able to get, when we're making a call out to get somebody come back or come in for the first time, 8% of those calls result in appointments. You may be doing much, much better than that, but you need to have a number that you're starting at to know, are we getting better or not? And then someone comes in for a presentation or a tour and an appointment. How many of those that come in, of all the total tours and presentations, how many actually move in? So let's just say there's a number of 20. So those are the 3 key metrics we think you need to really look at on the inside sales, where your admissions coordinator or your community relations director or your AL sales counselor, whatever you call them, those are the things that need to be measured internally as people come to your community. Now, out visiting the professional referral sources, we need to look at what's going on with them. Let me just see if this thing is clicking. Did it click?
We can't see it.
Okay, let me move this little screen over here. There, okay. In the old days, okay, see, they couldn't see us. Can you hear me now? Sorry about that. We accidentally hit the mute button. In the old days, you know, I know of communities who are getting 50% of the presentations in assisted living, not necessarily memory care, in assisted living to move in. So again, that would be a red flag. Hey, we need to be converting many more of these than we are at this time. Okay, professional referrals, 8%. Every time I go out, at least I know 8% of those people I talk to are going to start sending us referrals. That may or may not be acceptable to you. I would want it to be higher. But when you get to those professional referrals that are moving in, you see down here 25%. Uh-oh, red flag. You know, if they were referred by a professional, we definitely ought to be getting more of them to move in. So that number ought to be higher, and this gives us a red flag. So this is kind of, and you can even use the terminology red flag if you want to, but you need to just be looking at these on a weekly and a monthly basis. Establish a baseline of what is realistic in your market area, and then start measuring the metrics because, again, just remember this, the metrics can be predictive of things that are happening in the highly competitive market. As new competitors are opening up, you really want to start measuring are our calls, our inquiries, our closing rates, is all of that changing as a result of the competition coming in? Because now people have these other options, and what are we doing about that? Now, I'm going to share one more really interesting thing with you, and I won't take the time to ask the specific question because I know what your answer is going to be, and those of you that have know me and have been on other webinars may have seen this before, but and may have heard the question before as well. What's more important, the number of presentations or appointments or the quality of the presentation? And virtually everybody says, oh, it's the quality of the presentation by far, which is most important. And so I like to use a funny example of a guy that comes in or a gal to the manager and he says, well, how many presentations did you have this week? I had a great, wonderful, highest quality presentation I ever made. And they're moving in. Wow, great. How many others? Oh, that was all. I just had that one, but it was really, really good. Well, wait a minute. The numbers are important too. So that's kind of an extreme example, but let me just show you something. Let's say that, because I think this may have some of you think, wow, we had no idea of the multiplier effect of the sales productivity model. If you had 10 appointments or presentations in a certain time frame and the skill level that you have or your team member has on conversion of presentations into appointments, or rather into sales or referrals is 20%, then you would have received 2 sales or 2 referrals. 10 times 20% is 2. So you think, oh, well, Rick, you're talking about the numbers. So let's see if we can get everybody to see more prospects, family members that can potentially make a decision to move in. And let's go see more professionals. What will that do for us? Well, if the skills and the conversion rate are the same and all you do is look at the numbers, you're still doing 20%, 2 out of 10, but now you're seeing 15 people. You're all of a sudden up to 3 sales or move-ins just by looking at the numbers. But what if we say, well, you know what? Maybe we could get a little better in our presentation skills by doing some training and convert 3 out of 10 instead of 2 out of 10, 30%. What happens? Holy smokes. We've just gone from 2 move-ins a month or out of 10 presentations to 4.5 move-ins in the same time frame simply because we're seeing 5 more people during that time frame and we're 10% better in the quality of our presentations or in our skill level. It's a huge multiplier effect that a lot of people don't realize. In this case, it's more than doubled the results. One final thing I want to show you, and then I think we're going to get over to Chris here, is, okay, so how many calls should we be making? And what we like to do is say, well, let's look at how many leads you have in the lead base, because that's going to tell us how many calls you need. And you can categorize them by hot leads, warm leads, cool leads, future leads, or however you want. In assisted living, your hot leads are probably going to be those that'll make a decision within a couple of weeks. Warm leads, maybe 4 to 6 weeks. Cool leads, maybe within 3 months. Future leads, maybe longer than 3 months. We could give you some suggestions on how to set that all up, but the point is, look at the number of people that you have in your lead base, as well as how many new leads you're getting every week. And based on that and what the status of those is, you can determine how many calls a month that your community needs to be making. In this case, on the top line, the hot leads, you see 5. It's about 1% of our total lead base of 580. But if they're going to do something in the next 2 weeks, we probably need to be talking to them every couple of days. So those folks need 6 calls in a month, or 6 calls during that 2-week period, or 30 in a month. The warm ones, the frequency per month, maybe once a week we talk to those folks. But at any rate, this is kind of a chart that you can use, and if you would like the handouts, just let us know and we'll send you the handout so you can reference this. But it's a good way for you to really understand, well, do we have enough leads for everybody to be calling, or do we need more people because we got so many leads we can't keep up with what would be adequate or required follow-up activity. So let's go on over to more now about the role of outreach and let Chris Carruthers take over.
All right, Rick, thank you. So let's move right along here. What's the core knowledge that you need to be aware of as far as effective marketing results? So what I'm hearing a lot of people tell me, and what I'm kind of seeing firsthand is, remember how the old independent living marketing used to be? Like, it was more of that senior who was an older senior. Maybe they're not very active, and we have shifted our marketing over time to make that independent living prospect be more of the younger looking senior who doesn't look like they're 80, maybe they look like they're like 65 to 70. So the whole mindset of how we market has shifted. So I like to say, how we market assisted living is what we used to use in marketing independent living. So the tactics that we use for the old IL product, we're now moving into assisted living marketing, because again, the adult child is changing and their expectations are changing. So they're looking for a different way of marketing as far as how they can relate what we're telling them to what their parent might experience when they move to a community. They're very focused on lifestyle. They're very focused on quality. They want to know what their loved one is going to be doing every day when they move. So if you don't have a good program set up to talk about a lifestyle, it's going to be a very hard sell. And so that's the kind of thing we're seeing in some marketing tactics as well. Overall, the younger assisted living person prospect is going to have help with their adult children, even though they are younger. Maybe they don't have as many issues, and maybe they're not waiting until they're 85 to move, and then they're gimping along for 1 year before they're moving to skilled nursing, and they're not living with their children as much anymore. But that adult child is helping them through the decision process. So it could take about 3 to 6 months now before they look at a couple communities, go through all the websites, have an initial visit themselves, then go back and bring their parents. So what used to take about 2 weeks to 6, I'm seeing now is taking 3 to 6 months, because they're planning a little farther ahead when they can for that less fragile assisted living prospect. I still think adult children continue to be the key influencers, but I don't always think that they're making the decisions. I think they influence their parents, but their parents a lot of times are still the decision makers. So how you market to the adult children for the initial discovery is very different from how you market to your prospective resident, who really a lot of times is making the decision. And then, your prospects still listen to advice from people that they know and trust. That I don't think will ever change in any kind of service level that we talk about across the spectrum. People are going to want to feel comfortable with someone when they're making a decision to move from a comfortable home setting to a new neighborhood. So moving over into the actual process of outreach, you know how we have marketing plans for independent living and, people develop them. They kind of sit on your desk or in a drawer for maybe 6 months. You might grab them back out again and look at them again. Well, the idea behind a tactical plan for outreach is you have your outreach plan with the general information, general narrative about who your targets are, who you really want to reach, and how often. But then your tactical plan gives you a weekly and a quarterly snapshot of how you're really going to spend your time or your outreach person's time and what the results are that you're looking for. So it's results driven, just like with the metrics that Rick was talking about. You can have an outreach plan that your team may be utilizing, but what are they getting from that? Are you tracking the number of referrals that are coming from individual organizations? Are you finding out why you're not getting referrals from organizations, churches, social groups, civic groups? So using, again, the CRM to track your activity helps you measure your results. And I know from being in the admissions role myself years ago, there's not really a great tool. There has not been a great tool out there to really utilize to help you track your activity for assisted living, skilled nursing, rehab, and outreach, because it's almost, I still see people putting together Excel spreadsheets to track admissions and denials and referrals because they just don't feel comfortable with using reps or another CRM right now. And so you can't go back and monitor your results. You can look at them like month by month, but to go back and compile these results over a year or several years, you just don't have that report tool to really use to track your activities. So you could be spending all your time doing the same thing and getting no results, where if you had some way of tracking it, you could increase your productivity and your results and save you a lot of time and increase your census. I still believe that word of mouth marketing, especially in assisted living, is crucial. So the more relationships that your teams have with the residents and family members and then how they're treated in the communities is crucial. And then using surveys to measure satisfaction. That's an old way of measuring results, but people still want to know what experiences others are having in your organization. So to me, the role of the outreach person is a critical role because that person is out in the community every day, or in some cases, like if your marketing director is also your outreach person, it may not be every day, but again, as long as they're focused on the right organizations to target, they're out there. Are they asking the right questions? Are they opening in the dialogue to get the answers they need? Do they have the relationship they need to ask the right questions, just like you would with the salesperson, kind of doing discovery with your residents? Really, your referrals should be 50% of your admissions, and then an additional 20 to 30% should come from your digital marketing because you have your adult children out there looking on the internet, traditional advertising for awareness, and then we still like to use direct mail for events. And the ability to build relationships with your key influencers. Again, we talked about educating your adult child, and then anytime that you can get out into someone's home and see where they live. This is not anything you don't all know. What their lifestyle is, what does their refrigerator look like? There's a lot of ways you can figure out that whether or not this person is thriving or not in their own home. So what are some of the key characteristics? We look for someone very highly organized and disciplined because it's hard to put yourself out there every day and be set up for a lot of no's with getting in the door with some of these organizations. And churches are hard too. If you don't have a good connection with the church, it's hard to get past that gatekeeper. I've talking from firsthand experience. So you have to have someone who gets up every day and has that positive energy, is a strong communicator, effective listener. And again, these are all skills of what you would see in a salesperson too. The way they look, their professional disposition, I think. You don't need someone out there in a business suit looking like a pharmaceutical rep, but you need someone who's clean, professionally dressed, easily approachable, and understands all of the payer sources. And I say check this. That just means a note to myself to say, yes, this is more of a skilled nursing kind of notation here. But like Rick said before, I wanted to play back on his comment about even though you're not worried about bundle payment systems from an AL perspective, you're still kind of in that once you're in bed with someone for referrals, it's just habit that they're going to send any AL referral they may get to the same organization they're already under contract with for a bundle payment. So there are ways to look at hiring the right person. I always say there are trainable and non-trainable characteristics. For me, and for a lot of us here at Love & Company, we look for the non-trainable characteristics to be your heart, your compassion. And I'm not talking about someone who wants to be a Pollyanna and life is wonderful and they're not realistic in what people are going through, because life isn't all a bed of roses. But you have to have the right heart for this job. You have to have the right amount of compassion, and you can train and coach the techniques to go along with that heart. So just a few reminders, again, nothing new, but the big thing here is include some productivity expectations in your job description. You know, Rick talked about some of the metrics that we use to measure how many calls you should be doing each day. And again, with assisted living, it's not cut and dry like it is for independent. You cannot take the same metrics for independent living and apply them across the board to assisted, because each market is different based on the number of competitors you have with home care services and those kind of things. You can't just say across the board, these are the numbers that we expect you to use. But the table that we did show does help you to be a little flexible with plugging the numbers in, and then the formulas just populate to whatever you need to do. So I asked this question when I would give this presentation, sometimes in person, about what kind of background your ideal outreach candidate should have. And I don't really think it matters. I think as long as they have that ability to communicate well and develop relationships, if they have some clinical experience, that's great. But I wouldn't exclude anyone because they don't have a specific background that you might be looking for. Don't put yourself in a box on that one. So ultimately, who are you going to hire? Who have you hired? Who have you hired that you wished you didn't hire? The one with the heart, the one with the best communicator, like this gentleman here in the picture. You don't want to talk to someone who's always looking at their watch thinking, how much more time do I have here with you, poor average person? I'm trying to get back to something else and I don't really want to talk to you because you're boring the heck out of me. Someone who's connected. And again, someone who's got that clinical background is nice, but not necessary. All right. So these are just a couple ideas for you, takeaways for internal marketing. And I've done this before personally, and I promote it now as a consultant, but have someone in your organization make visits to your rehab center weekly. And I'm talking about spending 1 hour total, depending on how large your rehab is, and making a visit to each room, talking with the clients, your guests, asking them how their stay is, just letting them see your face every week. And then at the end of their stay, ask them to complete a survey so you can measure their responses. But the key to this is you're developing a referral program, you're developing word of mouth, positive communications, because when they leave, they're going to talk to a lot of people when they go, church people, country clubs, who knows. their children. And what they learn from you and the connection they feel with you as that kind of concierge while they're there is going to make the difference between having a good experience and a great one, because they're going to come back to you when they need another service. They're going to remember that interaction. And, it's an hour a week. It feels sometimes like it's hard to find an hour, but it's important that someone is doing that. And then this is an example of a wow sheet. I like to use the wow sheets to talk about really cool things that are going on in communities, and they could change. Maybe you tout a different satisfaction survey item, and maybe you tout the fact that Mrs. Smith moved into independent living when she was 82 years old and she's lived there for 5 years. So whatever you think are really cool things that you might want to share with the public, just kind of mix it up, use like a template that matches your brand, and it's a nice takeaway as well. All right, Rick, back to you.
Okay, well, thank you. So, who are the people that we need to be talking to the most as far as getting the referrals? And I'm going to share with you a really, really cool idea that I learned early on in the business, probably 25 years ago or so. But obviously, our targets that are pretty obvious are physicians and rehab centers, wealth advisors, financial planners, home care agencies. Wow, they're talk about a source for referrals if they're willing to give up their client. The home care people have tons of people that really need to be in assisted living and don't need to be in the home anymore. Obviously, the adult child. Hospital auxiliary people. Sometimes the social workers are going to say, oh, we only refer to nursing homes. We're not really involved in assisted living, but the hospital auxiliary folks may know some people. But let me give you a really cool tip, and it's not recorded here in the handout or in the PowerPoint, but it's something I thought of as we were getting ready to do this today. How do you know what these referral sources really think about you? And how do you know if they're telling prospects or their clients or their patients about you? So years ago, a fellow that I worked with said to me, Rick, we need to find out what these three hospitals think about our community. Are we even mentioned when some person asks for a referral to the better assisted living places in town? And I said, well, how do you do that? He said, well, become an adult child and call them. And I thought, wow, what a clever idea. And I tried it. It was extremely interesting, where you or someone calls the social service department or the home care agency or whoever that referral source is, a physician's office, and just say, I'm so and so from out of state, and my mom lives there, and I'm going to be coming to town in the next couple of weeks, needing to find an assisted living or memory care community for my mom. And I've been told that you guys know a lot about who the best providers are because you probably recommend them to places. Could you recommend any for me to look at when I'm in town? Well, guess what? You're hoping that you hear them recommend your community. And if they don't, then you got a problem. And you need to get in there, at least with that individual, and make sure they know about you. You also learn who they are referring to. Because if they say, oh, well, you need to check community A, community B, and community 3. I won't give you one name, I'll give you 3, A, B, C. And your community D, and you go, oh, shoot, he didn't even mention community D. We're not getting any word of mouth referral from this particular person who represents this particular organization. So that's a tip, and I guess you could almost call it mystery shopping professional referral sources. And it worked. I've actually literally done it. I even went to the point of going to a social services office in a hospital, posing as an adult child, going into the social services department, telling them I'm from out of town visiting. My mom needs to go into assisted living. And I wondered if I hear that you guys know a lot about these places. Who would you recommend? And they actually gave me one of the senior guides and then circled three places and said, these are the three that we think you ought to look at. So anyway, good way to test what they're saying about you. How do you reach these different audiences? Well, you can see the physicians in the hospital. I've actually had some luck back in the old days, actually going to the physician office and talking to the nurse or the receptionist. Again, wealth advisors, you can meet them, inviting them to be speakers, home care agencies through networking events, adult children through educational programs, civic organizations, and big digital marketing. Obviously, they're all online. Hospital auxiliary, if they see people going out of the hospital that they know are going to need some care, join it. And the last thing is to say that the healthcare market area is generally smaller than the IL market because there's so many assisted living places now, they don't need to go as far. If there's a decent one in the neighborhood, now there may be three in the neighborhood. So you need to look at, okay, where are the greatest concentrations of our prospective AL and memory care residents? And how do those concentrations compare to where we're drawing from? So you need to get the demographic data of where your folks are coming from, and are they coming from the area where they should be? And how is your draw of new residents from these areas being affected by new competitors that have come into those areas? And then one final point on this, and then I'm going to go back over to Chris because we're getting close to our hour, believe it or not. And that is, you can actually purchase lists of consumers now that show households with an elderly person living in a household. And Chris, I think you told me that they can even identify households where there's somebody with a particular ailment or
Yes.
physical problem, and
Correct.
zero in and do a mailing right into houses where there is a senior living with adult children, or there is a senior that's got Parkinson's or something like that, right?
Right. It's amazing. You can get a list almost for anything anymore. I mean, all you have to do is ask for what you need, and it's there. It's amazing.
Great. Okay. Well, I'm going to let you go back.
Okay. As we're winding up here, we always save the fluffy stuff for the end because by now, if you're like me, I can only focus for a short amount of time. So an hour is a lot to ask. I'll have to be like in front of people talking. So all the fluff is at the end here. So just some different things to think about. The first impression continues to be so important on the phone and at the reception desk. So don't lose sight of that. When you're walking through your community with prospective residents and their children, the interaction between the staff and the residents is huge. This is their home. You're all working in their home. How could you ever walk by someone and not even give them an eye contact or a hello when they're in their home? Things like that. How clean is the place? Is it welcoming, home-like? Um, so this could be an example of where someone's moving from. So it feels very comforting, very warm. It's their style. And then, they're moving to an assisted living residence, and then here's what they're getting. So it's just trying to match what they're used to having with what you can provide and thinking differently about how you can better match their lifestyle and their kind of their flair when they're moving. Why should they live in an area that doesn't feel like home to them? It's not decorated like they want it to be. So a little bit about the person-centered care philosophy. A lot of our clients are moving toward this, or what you might have heard about household model. But whatever the name is, if you haven't looked into it, I would strongly suggest, because it's really the trend of what everyone's doing with the flexible dining times, making this more about people choices that they have as far as menus and the dining times, how they sleep. One community that I'm working with has changed their linens from your basic linen to like even one grade up. Instead of having all the assisted living apartments painted one color. They have their choice of colors, and I'll show you some examples and curtains and things. Enhanced activities, learning opportunities. These people who are moving in, their adult children are looking for ways to keep their brains active. There's a lot about brain health now and how people have not just longer lifespans, but and more of the quality of life that you want along with those longer years. And so keeping your brain active is the big buzz right now. And then, are there opportunities for intergenerational? It seems like an easy thing to do. Bring a bunch of kids in all the time, but there's nothing better than seeing kids and animals brighten up someone's day when you're living in a building that you really don't come and go from as far as meeting outside people in your greater community or even sitting outside for a fresh air experience. So if there are less mobile people where you are working, that you've got to think about having some staff time to wheel people in and out. There's always volunteers. I mean, there are volunteers in schools. There are kids in high school who are looking for things like this for their resumes for colleges. Just need to be thinking differently about how you're enhancing people's lives. This is just a quick little slide to show the person-centered care philosophy with like how they can stay in control of their life. Who are the people who are supporting me and who are making things happen, and how can me as a resident, I as a resident, how can I help to support my plan, and how can you get to know me better? Because a lot of times your admissions team knows the residents very well. You've all worked with them, but when they're turned over to the neighborhood where they're moving into, they don't always have that time to really get to know them. And then they're moving in, there are things going on, so they don't have that time to really find out who they are. It's very important. So talk about moving to a new neighborhood, and if you don't have a private suite, a lot of communities are making like 2 studios a private. So really think about how you can adjust to what people expect. I think with the next wave of seniors coming up, the adult children aren't really going to put up with someone going from a home to a one-person suite or to a one-room suite. So that plus the features and fixtures, yeah, a lot of them are standardized, but provide more customization options. Again, think of it more like independent living and not assisted living. Why wouldn't you offer them the same things you would offer independent? So this is one community that I'm working with where we actually have design boards. They're going through a renovation process. So they can choose which board they want for their home. They can choose their paint, wallpaper, shower curtain fabric, balanced fabric, a little bit of wall art, and then they have like 2 or 3 templates, and they're not decorating with 10 different colors of paint, but they have choice. Make it feel like it's something they really want to live in. This is just another example here of a larger suite. So this is the kind of philosophy about dining and having it be more experiential when you're dining with your friends, your neighbors, instead of in a room where you've all got your assigned seats and you're coming in with, sometimes, I hate to say this, but the cloth, I don't want to say bib, but just making people who are in your assisted living program feel more like they're an independent living resident. That's where we're heading. Just another example of a dining space, family style dining here. And that's it. So I think Rick, he started out the presentation. I'm going to have him close by sharing the last slide. And then if you have questions, type them in real quickly and
we're going to try to look at the questions now. Just so you know, we're going to do another one on the 27th about lowering the age of entry through sales, primarily for independent living. It could apply to other areas of care, but primarily independent living. We've got some pretty clever ideas. People here at Loving Company, I'm finding, are always thinking about new ways to approach this market and to be more productive and more successful. So I'm going to scroll down and see if we can see if there's any additional questions. I think that I don't see any more right now. So I'll tell you what, if you have any questions on this, why don't you type them in right now and let's see if they come up. I'm going to expand that and see if there's more. We've got a little box here that shows us the questions, and I see that we had several questions that came in about the audio going out for a little while because we accidentally hit the mute button. Sorry about that. But I don't see, I think it would scroll up if there were more questions. We're right about at our time. So you can certainly send an email to us. Let me go ahead and put that slide up. Oh, wait, here we go. I'm sorry, I do now see that there's some other questions. What type of events have you found successful for AL and memory care? Chris, what kind of events have you found?
For those, we always focus those on the adult child. We have them scheduled like later in the day after they're off work, somewhere around 5 or 5:30. And if it's an event that's geared around an ailment that their parent may have, like Alzheimer's, when you mentioned memory care, something to do with an experience they're going through. The other thing we found is if you have like an adult child panel, like you would do like a resident panel, have an adult child panel and have them talk about their experience in finding a community and why they chose your community, and have them available for questions and answers. But obviously you're going to have scripted questions for them to address, but that's a really big hit.
Okay, good. And I have found, because I do a lot of events and seminars for independent living, and we're continuing to do those at Loving Company, and it has been frankly more difficult to get the adult children to come out. So you've got to be extremely creative, do it at a time that they're interested in. What we found, or I have found anyway, is that they come once it's a crisis.
Right.
And, well, I'm here because I need to move mom tomorrow to a place.
Sometimes,
so
yeah.
It is a challenge, and we're, as Chris indicated, working on that. We will send you the slides. I see a couple of you have asked that question. We know if you've asked a question, we're going to be able to go in and see that you've asked or requested the slides. So if you want to just type that in as a question, please send me the slides. We'll see it there. Or you can send us an email to the email address you're going to see on the last slide.
And there may be something on the follow-up survey too about the presentation.
That's right. Yeah, so I think we're going to send a follow-up survey to you. You mentioned digital outreach. What about print? Very good question about print. Well, wait, there's one more question before that. We'll get to the print in just a minute. And let me just say, how to market to the doctor's office. What do you think the best way is? I'm going to just tell you what we used to do. And this was back in the old days, back with the Brighton Gardens communities years ago. Some of you are familiar with that. We actually would go to the doctor. We would go to a medical area near a hospital, and there's doctor's offices, tons of them, all right in the same area. So we would go in with the director of community relations, and I would be with him, kind of supporting him on it, just to see how it went and show him how it went. We would go in and we go to the front receptionist desk and say, "Do you see a lot of seniors here at this practice?" "Oh, yeah. Oh, it's all we see is seniors, sir. How can I help you?" "Oh, well, somebody here needs to know about us. If you see a lot of seniors, who in this office is the person that talks to the senior or the family member if they bring up, well, we might need to move into assisted living, or mom might need memory care? Who in your office is the one that would be talking to those folks?" "Oh, well, it's the nurse, Mary, over here." "Well, is she available? Could I leave some information with her? Because I think we'd have some information that would help her very much in talking with those families that she talks to." "Oh, sure." Or, "No, she's not here. Can you just leave the information?" "Good. Does she have a card?" "Yes, here's her card." Great. You have just found out who in that physician's practice is the one who talks to the families or the seniors about assisted living, et cetera, et cetera. And we actually got results out of it. And you can see a lot of people in a very short period of time. And obviously you go to offices that have the practices that are caring for the seniors. In memory care, obviously, you go to the psychiatric places and things like that. But basically, just say who, be really nice and friendly, have some material to leave. Who in your office would be the one that would talk to seniors or families if they ask about options for assisted living and memory care? And normally the front desk person will even say, "Oh, it's me. I do that."
Right.
The doctor's busy. They don't want it. They don't have time. But whenever that comes up, the doctor says, "Well, go talk to the lady at the front desk, and she'll give you a list, or she'll tell you about places."
And we have one more question. I know we're a little bit over, but what about print advertising? We don't really recommend print advertising unless it is for informational or for an event. We just, in most markets. Now, I've seen some markets where it actually does work, but we don't really recommend doing a lot of print, like maybe in your senior housing guides and things like that. But we're not big proponents of the print advertising for assisted living. Adult children just aren't reading it.
Right. So we're actually doing the discussion as we just have on the slide here. And thank you very much for attending today. And I'm glad that we were able to figure out how to get all your questions answered, or see that you had them and then answer them. And thank you all for joining. And let me just go back to when the next one is, so you have that if you're interested. If you guys have a community that's got a need for younger residents, we're starting to make some real progress on that. So it's going to be September 27th. And Sue Dalton and I will be making that presentation 1 to 2 p.m. Eastern. And you can go to Love Leadership Webinars, I guess it's probably .com, to register. Okay. So thank you all very much. And sorry we ran a little bit over, but
thanks for the great
appreciate
turnout.
your time. Have a good rest of the day and have a great weekend as well. Thank you.